So please start.
Uh, we have Dr. Sugandha with us. She is a rank 14 achiever in this year in INI-CET. So thank you, Dr. Sugandha, for being on this platform.
Thank you,
Very
sir.
big congratulations to you on your success. And I'm sure your success is something which is a big inspiration for all the students who will be watching this video. So thank you for you to be on this platform. Please tell us something very short about your journey. How did you start preparing? What all topics you felt were important in these exams, subjects particularly which were important in these exams, and how much time did you give for the app versus your textbooks?
So firstly, I started my journey as a MBBS student. So I firstly focused upon my clinics, my ward rounds and my OPDs so that I could get a wholesome picture of the patient. That helped me to understand the pathophysiology of the disease behind it. And the clinical videos of the app helped me a lot in making my uh, notes and my histories and my examination very clear about the patient. Then I would then I would thought if I was the clinical treating physician, how I would like to go about treating the patient, and I then looked upon the treatment that the treating physicians they were giving, and I discussed with my seniors and my mentors where I was going wrong in making a diagnosis or giving a particular treatment to the patient. After that, I noted all the pathophysiology that I was weaker in, and I noted all the points that I would like to have more clarity about. So, firstly, in my third year, I started becoming serious about the upcoming entrance examinations, and started making notes. I started doing MCQs side by side of that particular subject so that I could finish all the core topics of the subject. Then in my internship period, I did about 150 to 200 MCQs per day of multiple subjects together. Like for 50, if I was doing about anatomy, then 50 of physiology and so on, so that I could get a wholesome picture and not in tips and bits. So I took a particular subject. I took a particular system as a whole. For anatomy, I did the CVS anatomy. Then I would study its physiology, its pharma, its path, and then I would go on to medicine and pediatrics so that I could cover a whole topic subject that is more important in the upcoming exams.
Okay. So, 2, 3 takeaways. First, you focused on the clinicals and started focusing on the clinicals starting from the history clinical examination. So, you try to secure your rank by starting from the basics. And since we have now the pattern of these exams changing, so we are likely to have more clinical based questions. So your focus was correctly directed towards paying more attention towards the clinical. Second, you talked about the MCQs. So, and a very useful way that you told was, I understand you were taking topics and you were actually answering the MCQs in an integrated fashion. So you're for answering the anatomy part also MCQs and which is a very good and a unique way of studying. I'm sure the students will find it very useful. When did you start giving your GTs? I'm sure you must have given your GTs. When you start giving your GTs and how useful were they for your preparations?
So I started giving my GTs in my internship period only. So there was a misconnection. So, I started giving my GTs in my final year. I start in my internship period. Sorry. So I could in the GTs I used to review them by going through every question, and I had multiple compartments in my study room about in every subject that I had written very specific topics of a particular subject. I could never be weak in surgery as a whole. I could be weak in the GIT section. In that too, I could be weak in the surgery part or the bariatric surgery part, what the surgeries are done. And in this year's paper, there were many image-based questions of the surgeries that were done in the real scenario. So I had a diary in which I had written about all the topics that I was weaker in a particular subject. And in the last 10 days before the exam, I revised all of those topics of each subject in a fast manner so that I could get hold of my weaker subjects in the final go. And during my preparation, I made my strong subjects very strong so that I could devote less time in the last 10 days as compared to my weaker topics, but I had never ignored my strong subjects as a whole.
So very important for the students to segregate and know what their weaker subjects are, what their stronger subjects are, and without being too overconfident about their stronger subjects on the stronger subjects. It would be very helpful if they pay more attention towards the weaker subjects. Okay, so how much you must have gone through the question banks also on the app and the questions that were given in our GT. So how I'm sure we have put in a lot of effort making those question banks very accurate and increase the content value, add more case-based questions. How useful you have found them, and if there are any suggestions where you can tell us where we can further enhance the content value of both the GTs also as well as the question banks also.
So I found the question bank of the app very useful in a way that it had segregated all the topics very nicely in a manner that we could identify the topics and not the subjects as a whole that we are weaker in. We could identify the strong subjects but never be overconfident in that, and we could identify the weaker subjects but not be overwhelmed by the weakness that we have. So the question bank was very useful, and the GTs were simulating the real exam scenario in a way that they were very similar to what the real exam was, and the video explanation as well as the written explanations were more than sufficient for the particular topic that we needed to revise. Yes, sir.
And any standard textbooks that you would, I mean, we all know the standard textbooks of each subject, and the students are well aware which standard textbooks to go to. If there are any particular subjects where you feel there are additional books which can be, I mean, equally handy or probably can be a great accessory support to the standard textbooks, please tell the students about it.
So for the standard textbooks, for every subject, I analyzed myself and I curated every topic according to myself, uh, rather than going into some imitation or all. So for like pathology, I did line by line reading for during my second year of the topics that were there in the Robbins only, and I found the images very helpful. And apart from that, the physiology I found Binong very useful. But in pediatrics and gynecology, I suppose that the Indian author books were more useful than the foreign authors because they were more understandable and more handy in building concepts than the foreign authors. In medicine, I would like to say that Davidson is a very handy book, but you can refer to particular topics from Harrison if you want to build concepts, and you should build concepts about like and CVS in neurology. We can refer to Harrison. It's a wonderful book for that. But for our exams and for being a handy book, Davidson is a very nice book.
So Indian standard textbooks actually, according to you, should be good enough for most of the subjects. Yes. And some other standard textbooks, foreign textbooks, especially Robbins you mentioned, yes, which are the gold standard textbook for pathology. Similarly, we have Harrison for medicine, but as you correctly said, only certain specific topics. Even for pediatrics, I don't recommend Nelson one to go to. We have already added those notes in our app. So there is no need to go through those laborious Nelson textbooks. That takes in a lot of time. It's a lot of time. You went through the clinical videos also, and how useful were the clinical videos, and any particular topics that you want we can add in the clinical videos to further improve them.
So in the clinical videos, I found them very useful in a way that I could look firstly to the clinical videos and then go to my wards so that I could not falter upon any finding or any examination that I was doing on the patient himself. So I used to look through the clinical videos first. In my traveling, I used to like when I used to travel by metro, I used to look at the videos, and then I would go to the hospital and do the examination myself. It helped me retain my memory for a longer period. And in the upcoming exams, it's very helpful that you go through the clinical videos so that you could find a wholesome approach towards the subject.
Any particular topics that you want can be added in the clinical videos to further improve, which can be very helpful for the students. In surgery, I think you mentioned hernias.
Yes, there can be a feedback section from the students where they feel a particular examination to be tricky in a live patient. They like for hernia examination and for breast examination. In the real scenario, we can ask for his or her consent for only once. But if we have a look at the videos and then go through that video and do the examination only once, so that we can preserve the privacy of the patient also, and we can do the examination that we need ourselves also.
Okay. Uh, Finally, one last question about the notes, the faculty notes. How helpful were they? And any particular notes that you found were very useful, wherein there was no big need for going to the standard textbooks. Those notes were good enough. Please tell something about that.
So all the notes were very helpful, but I would like to especially mention Dr. Neha Agarwal's mom's Parson series. That was very useful. I always took ophthalmology as a volatile subject because it was not something that we could see. We could have. We uh, need to imagine a lot in that. But ma'am's way of explaining line by line the textbook and ma'am's way of examining the patient was very useful to me. And yes, so she was the teacher
We
that.
found the notes to be useful in your journey. So, okay. So, thank you very much, Dr. Sugandha. Won't take much time of yours. Thank you very much. We first congratulate you on your well-deserved success and blessings from all of us here at DBMCI. And it's very helpful to know that we were a small part of your journey. Obviously, the parents' blessings and your hard work were instrumental in providing you this rank, but it's very nice to have our students secure such good ranks. Even we as faculty sometimes feel that this is the rewards that we actually can reap from our hard work as well. So thank you very much. It
Thank
was
you so
very
much.
nice and a pleasure to have you on this platform. Thank